Hey, welcome to the Infinity Podcast. It's Warren here. In this episode, I'm going to be talking you through understanding pain. So the title of this podcast is Living with Pain and how strength training could be the secret solution to helping you get over it. Now, I want to give you some insights into this and I want to help you to understand what pain is, how it works, and how we can potentially navigate our way through that. Now, everybody's situation is totally individual. So hopefully I can give you some insights that you can take away and use yourself, or you might be able to come back to me and ask some questions. I have a huge interest in pain, so I'm going on my own journey with this in exploring it because I know what it feels like to have persistent and chronic pain. I had an injury back in 2016, which left me feeling debilitated for a long, long time, where I thought I wasn't going to be able to exercise again. Now, as a result of going on that journey, I was able to figure out a lot of things and I found a new interest in what I was actually doing. And it also helped me to see that a lot of the ladies that we work with here at Infinity go through those same challenges. Now, if you're not aware, personal trainers, as we're taught, are only able to work with people who are healthy. But the majority of people who come to a personal trainer aren't in the position that they want to be in terms of their health and fitness. So they come to work with us in order to get out of that. But a lot of what we're taught within the manual is just to work with people who've got a healthy condition, whereas 80+% of the population just aren't in that position. Now, I want to give you a little bit of insight into me if this is the first time that you're listening to it. So I'm Warren, I'm a personal trainer. I've been doing this for over 10 years. As I said, I've got a vested interest in working with people through injury rehabilitation. I have been to university as a result because I went on this journey to become a personal trainer to help people to get fitter. And I thought that I could help everyone. But what I found is that I really enjoyed working with ladies who were over 40, who were potentially moving towards the menopause, which is another topic that I had a vested interest in because I didn't know anything about it when I first became a personal trainer, which is totally unfair to you if you're a lady who is going through menopause to work with someone who just doesn't understand that. But not only that, all of the conditions that I'm talking about, I've been able to work with people who've gone through rehabilitation with back pain, who've had joint and knee and shoulder replacements and a whole host of other things. So I'm able to work with people on a lot of complex cases and just give you peace of mind and empower you to make the decisions that are going to move you further forward in terms of the results that you want to see. Now, we offer small group personal training here at Infinity. We work with groups of 6-to-1, so that means 6 ladies to 1 coach, meaning that we can personalize the approach that you have when you come into the gym. So if you're dealing with chronic pain, we can make accommodations for that. Not every single person who comes through the door is going to do the same exercise. They're not going to do the same intensity, the same weight, the same reps even. So we can tailor everything that you need to get you the results that you want. My interest in pain and movement started in 2016. I was in a competition doing a powerlifting meet, if you know what that is. It's essentially 3 movements: squat, bench press, and deadlift. And it was on the last one, the deadlift, where I was picking a weight up off the floor and I pulled my back essentially. All I heard was a bang. The weight dropped onto the floor. I was none the wiser. And then I went to take a step and then I had no strength in my leg. I get helped off the platform. At that immediate moment, there was absolutely no pain. It was only when I got in my car after that to drive home that I realized how much pain I was actually in. I was sweating profusely. I was struggling to breathe. And when I got home, I couldn't find a comfortable position to get in. So I imagine that I'd done some minor damage to that, I'll say, but it was causing a lot of pain. So potentially compression of the nerve. After that, I went on a long rehabilitation process, worked with a physio. So it helped me to understand a lot about my body, but it was really debilitating and it was quite depressing in a way to deal with that, to go from being physically healthy to not being able to lift any weight at all. So I appreciate how hard it can be when you're dealing with pain. Now that's been said, I just want to break down a few things that I'm going to go through. I'm going to talk through some topics here just around my ideas and my learnings from working with people and understanding the research that goes into pain. Now, I'm not saying that this is the be all and end all because pain is not black and white. There's a lot of gray areas, and I'm sure if you've dealt with pain, you might have spoke to medical professionals before where you just left in limbo. They give you a statement or a throwaway answer to a question that you might have and you feel like you're none the wiser. It's not my hope to do that today. It's my hope to empower you with some knowledge and understanding so that you can make decisions that are going to help you to take the next step. So let's start off with what is pain and what causes it. Now, think of pain as an unpleasant sensation that makes us stop and think about what's going on and potentially change our behavior. Now, if you put your hand on a hot doorknob, think of Home Alone, you're immediately going to pull your hand away. Now, for some people, this can creep up gradually where you've got pain in your back, and then gradually it gets a little bit worse. So what happens there is we've got a heightened sensitivity to a similar stimulus. Our body is effectively a protective system when it comes to pain to tell us not to do something if it's potentially going to cause us harm. So another good way to think about this is if you've got a car and you've got parking sensors. I used to work in the motor trade. If you've got a car and you've got parking sensors in your car, when you're reversing up to something, those parking sensors will progressively get faster and faster until you get to the point of about 30 centimeters away. I fitted these, so I know about 30 centimeters away, and it'll be one tone. And that'll tell you that you're so close that you should stop, because you're probably not going to be able to open the boot if it's a tailgate. And hopefully in that instance, you will stop. Now, in the motor trade, we had this funny thing when someone had fitted parking sensors, or if they repaired the back end of the car, put a bit of tape over it, and you had that constant beeping sound the minute that you put it into reverse. Now, imagine this like your pain system. Whenever you've got something like chronic or persistent pain that's been happening for over 3 months, you can potentially have a greater sensitivity to that pain. And another good way to think about it in terms of pain is if you burn your hand and you go into a room that's a normal temperature, you're going to have a heightened sensitivity to that room temperature than anywhere else on your body, than you otherwise would have if you hadn't burned your hand. So it's important to understand that the pain is a protective mechanism. It prevents us from causing further injury. So that heightened sensitivity in your hand, if you burn it, it's going to stop you from potentially causing further injury if you were to put your hand under a scalding tap again. In the other sense of it, if someone is dealing with pain, movement can help to reduce that sensitivity, but it needs to be done in a way that is gradual and progressive. A lot of people get really worried when they've got pain that they don't want to do damage, and they stop themselves from doing a lot of stuff. Now, this might reduce the pain in the interim, but what often happens here is that you have a reduced ability to tolerate those movements again. So if you move outside of that range, you are potentially going to create that pain again. Some of the other factors that can lean into what creates pain or what causes pain is a lot of visual things and a lot of environmental factors too. So a really good story that I heard to help me understand pain is that there was this guy, and this was in a British medical journal. This guy who's a builder, he's jumped off something and a 15 centimeter nail has gone through his boot. He drops to the floor, he's in excruciating pain. They have to get an ambulance to him. They take him to the hospital and they're like, right, we can't take this boot off until we've scanned how bad the damage is. So they do an x-ray on the boot and they find out that the nail has gone straight between his toes. How lucky is that? Now, he was in excruciating pain. That pain was so real because of the visual impact that he was having on his brain. He thought that that nail was through his foot, and it was probably the same pain that he would have felt if it actually was. Another example of this is a guy experiencing labor pains. So I laughed when I read this because, I mean, I've got a daughter who's about a year old now. I never experienced this. But it is true that some guys who go in with their partner, they have such a strong connection that they can experience the pains too. The video that I watched of this showed a guy actually fainting. So you can imagine the different stimuli and the different environments that it can have an effect on us. A lot of people can feel nauseous from seeing certain situations, and our bodies react in the same way. It doesn't make it any less real. Everything that we experience is real based on what is inside our bodies. It's just an indicator to try and protect us. One of the ways that I explain to our ladies how to think about this is like a spirit level. So you've got your two lines on the spirit level, you've got your bubble in the middle. And if we're in pain, those two lines are going to be a lot narrower. If we're not in a lot of pain, or if we're moving gradually away from pain and we get a better tolerance to it, those lines are going to move further apart. So when that bubble's moving from side to side, we're going to have a lot more tolerance before we actually experience any pain. And that's a cool way, I think, to actually think about pain. Pain can present itself from physical trauma, but it can also come from psychological trauma as well. Even though it might be psychological trauma, it might present itself as physical pain within the body. So it's just important to think about those things. Some of the common problems that ladies that I've worked with have faced after the age of 40 is going to be joint pain. It's going to be back problems. It might be as a result of inflammation. It might be as a result of going through the menopause. But a lot of the lifestyle issues that we have are going to lean into that: being sedentary, being less active, having poor nutrition. Although when I'm talking about nutrition, I like to think of this from the side of, I'm not telling anyone to eat in any particular way, but if someone's eating a lot more foods that are going to cause inflammatory behaviors and they're sedentary, then there's potential problems that can come from that. One of the biggest factors around this, and why I want to help so many people, is that the NHS, in my eyes, although it's absolutely brilliant and it's free, it doesn't do a good enough job in terms of preventing people from going back in. Case in point, when someone goes in for a joint replacement, my dad has had a hip and a knee replaced, and he's had problems ever since because he was never rehabilitated properly. He was never taken through the point of guidance in terms of strength training. So once he'd had that, once he'd had that replacement, he essentially went back to the way that he was living before. Now, the problem with this is it didn't place any strain on the body, or it didn't place any stress that allowed his muscles to get stronger around that joint to protect it from future problems. And this is one of the biggest things that so many people don't understand. The waiting times within the NHS, if you have a back problem, chances are you're going to be waiting 6 months. Within that time period that you're actually waiting, that back pain might go away and you feel bad for going in. And then the doctor, or you go in and you've still got that back pain, and the doctor says, I want you to rest and then come back in 6 months. And then you're going through an endless cycle of meeting the doctor, the GP, and then you go and see the MSK specialist. They might say, right, I'm going to refer you to the physio. Before you know it, you're 12 or 18 months down the line. So the problem with this is twofold. It's obviously causing you a lot of stress if you get into the point of going to see the doctor, because a lot of people have already put it off for months before they actually take that point, and it costs an absolute fortune. Then to have people be dismissive and tell you to just go away and rest it, it's quite frustrating. And I see this time and time again. The consistency in terms of help is neither here nor there. Especially when you're seeing a physio within the NHS, you're probably seeing them for around 7 to 20 minutes, depending on what the appointment looks like. And the problem with this is, if you go back and you see a different physio, they might give you a different answer. A lot of physios, if you're not aware, like their guidance and their practices are based on their beliefs and values. So some people might push you towards acupuncture, some people might push you towards manual therapy, massage, and things like that. I'm not saying that any of those things are bad, but they've got to align with your beliefs and values in order to get you the best rehabilitation possible. Because me sitting here, I'm talking about strength training because that's what I do. But me sitting here and saying to every single person who's listening to this that strength training is going to be the be all and end all of you getting away from pain, specifically if you've got ME or you've got fibromyalgia, you've got chronic lower back pain, or a whole host of other things. The problem with that is, the first time that you go to do that exercise and it causes more pain, you're going to feel that something is broken. You're either going to potentially feel that I'm full of crap, or you're potentially going to think that there's something more wrong with you, which leads to further down the line, you're not getting to where you want to be. So a lot of the healthcare that we get is based on opinions, it's based on beliefs and values, but the treatments are based on what they have probably learned in a textbook. Now, I heard a really good thing in terms of we should let research shape our understanding of a situation, but we use experience to gain insights into that. So when I talk about strength training being a potential solution, it needs to be done in a particular way for that person. There has been lots of times when I have thought, oh, I've figured this out. And then I have another person come in who's got the similar situation and they've struggled with it. It hasn't worked for them. So what we need to do is understand the individual who's in front of us and have empathy and understanding for that person, and also ask you essentially what you want from it. I know that for a lot of people, especially the ladies that I've spoke to, you go into the doctors and they say, oh, tell me what's wrong with you. And you're like, well, that's what I'm here for. When I'm talking about asking you what you want, obviously you want to be out of pain, but we need to understand exactly what you're willing to do in order to get out of that pain. Because if I say to you strength training is the best way to do it, you might only half invest in that. Chances are if you do that, or you only show up every now and again, you're not going to get the results. But if someone's genuinely interested in it and they think they want to give it a try, yes, it can potentially be helpful. Another notion that a lot of people will say, and I want to sort of quash it, is movement is medicine. And I don't like this. I have said this before, just full disclosure. My big problem with this is that medicine is medicine. Medicine is meant as something that is there to prevent disease, to stop further problems. And I think that movement being stated as medicine is problematic because we're essentially saying, oh, you don't need all of those pills. Now, again, full disclosure, I have told people in the past that I haven't taken pain medication until the point of 2016 when I was in debilitating pain and I had to have cocodamol and tramadol. Funnily enough, I had the best night's sleep ever. Now, without that medication, I might have been having severe problems in terms of lack of sleep because I couldn't find a comfortable position. That might have impacted my mindset. It might have led into anxiety, depression, and loads of problems further down the line. So I just want to state that outright, is that medicine is suitable for people that need it. But obviously I am not in that role, so it's beyond my scope of practice to recommend things like that to people. But if your doctor recommends it to you, they should be taking into account where you're at right now and helping you to understand what your options are around that. If you decide not to take it and you want to go down the movement route, that's absolutely fine too. But do that with the guidance and support of a medical practitioner. If someone says to you, movement is medicine, they are missing the point of what medicine is designed for. The other side of this is I want to talk about some of the ladies that we've actually helped, because when it comes to strength training, yes, I do genuinely believe that it can be super helpful in terms of alleviating pain, reducing the sensitivity to pain, and helping people to feel stronger as a result. Because of all the stuff that I talked about within the NHS, I think that someone investing in themselves to work on themselves to reduce that pain, but also to get into a fitter and healthier lifestyle, is going to help them to be more resilient and more robust, harder to kill, if you like, in the long term. Now, if this is something that you're interested in, it is going to take work. I just want to be honest with you. So one of the ladies that came was Liz. She was having a lot of problems. She was struggling with sleep. She's had 2 knee replacements, 2 hip replacements, and very recently she started doing a lot of mobility with us. Now, when she first came to us, she couldn't do something what we call a squat to stand, which is essentially where you'll squat down, place your hands on the floor, and then keeping your hands on the floor, you'll lift your hips up in the air. She had to take her hands off the floor. So what we would do is use a box to raise that position up to make it a little bit more manageable for her. Since she's been working with us, she's been able to do that. She's also been able to get a knee down when we're doing things like lunges and split squats. Another lady who's just started with us, Leslie, has been able to squat better. In fact, just the other day, she was telling me that she was showing a neighbour how she can actually squat down a hell of a lot better now. Now, this happens to a lot of ladies who come to us, but I don't want to sit here and say that this happens instantly for absolutely everybody. We have some ladies like Hannah who came to us, her doctor had said to her that she had the knees of a 90-year-old. If ever your doctor says this, by the way, I would directly question them outright, because how do you know what a 90-year-old knees look like? I mean, if you're a doctor, you're a GP, chances are you're not doing surgeries on knees all of the time. Yet you're going to see a lot of problems, but you're also going to see a lot of people who are coming in who've got problems anyway. So it's really unfair to say that to someone. And I can't imagine what that did to Hannah's mindset to start off with, because she was very reluctant to do a lot of squats. It took a lot of time and guidance to get her to the point where she felt confident in it. But now she's able to actually squat with a weight that's equivalent to her body weight. So she's a hell of a lot stronger as a result. Now, it did take time to not get through the physical side of it, because we know how all that works, but to get through the psychological side of it and to help her feel like she was more confident from there. We have Helen, who came to us after having a little bit of time away. So Helen trained with us back in 2020, just before lockdown, and she came back to us and she was suffering with fibromyalgia. Since then, I've been constantly asking her how she's finding the pain sensitivity, and she's always saying that she's fine, which is amazing. But again, fibromyalgia is one of those chronic conditions where it can severely fatigue someone. It can leave someone struggling to sleep. I have worked with people in the past who've come in and the intensity of the training has just been too much initially, so we've had to dial it right back. So this is what I'm trying to get at with training, is it's a personal experience. Even though two people might have fibromyalgia, they might come into the gym and they might train. For one, it's too intense. For the other person, it's really manageable. So we need to manage it based on a case-by-case basis, understanding the science behind it and the symptoms and the problems that that person might face, but listening to what that person is saying. That's what I found is so important in helping anyone to get past having injuries. One of my longest standing ladies, Marie, came to us. We often joke about this. So Marie loves to go out on walks, and I think she was on the Cleveland Way, and she over Saltburn Way, and she'd gone out for a walk. Anyway, she took a slip on some rocks and broke her ankle, I believe. Funnily enough, she had to get the Coast Guard out, some lovely guys to carry her off on a stretcher, which she got a nice picture of, but it never stopped her training. And this is one of the things that I want a lot of people to understand, is that even though you might have an injury, it's not an excuse to stop training. Now, I've had other ladies say to me, "Oh, I can't come into the gym today because I've sprained my ankle." And I've said, "Just come in, we'll work on the upper body." And they've come back to me and said, "No, I can't walk." I was like, "But you can drive your car." And look, honest answer here, if someone's not willing to do it and they want to just rest up, that's fine. But for a lot of people, they use that as an excuse, the first chance they get to stop doing things. So if you go to the doctors and the doctor says to you something that you're not happy about, "I just want you to rest," after 6 months of being resting, it's probably not the right thing. It's not going to be helpful in the long term. So I would turn around to them and say, "Listen, I've been resting for 6 months while I waited for this appointment. Can you recommend something else, or can you refer me to someone else?" One of our other ladies who doesn't train with us now, she's moved to Australia, Jolene, she came to us. She'd had a couple of incidents, a car accident where she'd had a shoulder damaged, but she's since gone on to get stronger and stronger, and we still keep in touch with her now. She's still training down under, getting stronger with a gym down there. We have another lady, Charlotte, who had a spinal injury from a car crash. She broke her back, and she was told that she was going to have problems throughout life, but she went from strength to strength. These things happen to us, or these things can potentially happen on a day-to-day basis. Like, we all go through challenge, we all experience pain in one way or another, and the ways that we're able to overcome them are going to make us stronger as a result. The one thing that I don't want so many people to think with this is that they're going to walk away with strength training being the be all and end all. I genuinely believe in it. I think it is probably the elixir of life. Like, it's going to keep you youthful for longer. I'm seeing more and more content on social media now around people who are in their 80s, 90s, and beyond that, who are still doing strength training. There was a lady just recently that I seen doing gymnastics. She was about 93. She's on the parallel bars, she's swinging, she's kicking her legs over, she's enjoying time, like, everyone's clapping her. And I think this is amazing. So many of us want to live a long and happy life, but if long and happy means sitting in a chair and spectating and watching everybody else, I think that we've been misled if we're looking for that. But that's just my side of things. Now I want to talk about one of the myths. A lot of people think that by doing exercise, they're potentially going to make it worse. I have heard stories from clients who've been told by their doctor that they shouldn't be doing exercise because it's too intense. Now, for me, this is a case of me not prescribing medication because I'm not a medical professional. Stay in your lane. When a doctor does that, and I mean, I'm not going to name the person in particular, but when a doctor does that, all it shows to me is misunderstanding about what they believe that to be. When we say strength training, a lot of people will immediately take their mind to heavy weights. Very, very similar to that. When I say, oh, pick that up off the floor to someone who's got a bad back, they might wince at the thought of that. So it's really important to understand where someone is coming from when they give us any help and advice. And for the most part, when someone tells us not to do something, it's based on their own opinions, beliefs, and values around a particular thing. I guarantee that that doctor probably isn't strength training. Or if they are, they don't know enough about it to give any recommendations or guidelines on it. Now, when it comes to doing strength training, specifically around pain, it's really important to understand what is happening within the body, because potentially the first time you strength train, you could experience some soreness. Now, as I mentioned previously with that lady who had fibromyalgia, she experienced soreness that was way beyond what she was expecting. It left her floored for a couple of days, which is very sad. And I hate to think of that like as something that I've created. But in the same sense, she never did anything that a lot of our ladies would have done who've been there for a long time. She was doing bodyweight exercises, and it was only things that were going to be super helpful for her in the long run. But it placed a lot of doubt in her mind, and hopefully she was able to see as a result of doing that she could do other things. That might be aqua aerobics, it might simply be walking on a treadmill, I don't know. But when you do exercise, you get what's called delayed onset of muscle soreness. Some people can get this worse than others, and this is a totally unique experience as well. How long we've been doing exercise is going to determine the how much the pain is magnified. So, for example, someone who has never done strength training before, they come into the gym. A lot of what we do is based around mobility as well. So we'll work on getting someone really low down in a squat. If you've never been in that position since you were a child, let's say you're in your 40s or 50s now, the chances are that's going to cause a lot of soreness for a couple of days. Now, if we do that same workout again the next week, it's going to cause less soreness. And then the week after that, probably less soreness. And then the week after that, it might not cause any soreness at all. In that instance, we can start loading that up and look at introducing what we call progressive overload, which means that your body is getting stronger. It's starting to adapt to it. So we need to look at a new stimulus, and you probably won't get the same level of soreness again, but you'll start to notice that your body's getting stronger. Now, please don't take that to mean that no pain, no gain, because that's another myth. A lot of people will push through pain and cause further problems in doing so. If you're experiencing pain in your knee when you're squatting down, we need to change that. We need to look at and evaluate that and see how we can make it better. Now, I'm not saying that I would immediately change something if someone was experiencing some discomfort in the knee, because if you've had a knee problem for a while, one of the main things to understand is that you can experience pain even though it's discomfort as well, because you've got that heightened sensitivity to that pain in the knee. When you start to stretch the muscles, that pulls on the knee joint, which makes it really uncomfortable. So what we're trying to do there is we're trying to mobilize the muscles around the leg, but we're also trying to decrease the sensitivity of pain in the knee joint. So we need to do it in a gradual way. If we do that, the chances are a couple of weeks down the line, you're going to be in a much better position. Similar to the story that I told you about Hannah, when we first started getting her to squat, it was really uncomfortable. Now, every now and again, she will have flare-ups with this. So we need to manage that based on where she's at. And a lot of the time with Hannah's particular case, I'll look at how she moves. Hannah's knees move further over her toes than most people's do. Now, a lot of people think that that's bad, but it's not. Hannah has a lot more mobility in her ankle joints and her knee joints in comparison to her hips. So what I'll get her to do is sit further back so that we're working the hips a little bit harder. And those small changes have a massive impact on that person's ability to work the legs. So it's just increasing a different challenge, but it takes some of that pressure off the knees. Now, as I said, Everybody is different. So how we do this for different people is going to depend on how I see them move. The next thing I want to talk about is arthritis and joint pain. So a lot of people have a lot of problems around the joints when they get to 40 plus. Increasing the strength around there can reduce some of those symptoms, but not always. Some people have got to the point where they've got arthritis in the knee joint, for example, that's going to require them to have a knee replacement. Now, once they've had that knee replacement, that's going to reduce some of that sensitivity to pain. Then we need to start strengthening those joints, but we can work around that as well. A lot of times I've had people come in who've got knee pain and I've still got them to do leg workouts because we've done deadlifts instead. We've sort of balanced out the muscles so that we can take some of that pressure off the knee joint and start to strengthen the backs of the legs to support that. And again, it is individual, but the main thing to take from this is we've got to listen to our bodies. We've got to fully understand what's happening within the body to make sure that we give ourselves the best options moving forward. Now, strength training has a lot of benefits. It is super helpful when we are trying to lose weight. In increasing muscle mass, we're going to increase the amount of energy that we're burning at rest, but also we're going to magnify the amount of energy that we're burning when we're actually exercising as well. So muscle mass is a really important contributor to every area of your life. One of the biggest risk factors for people as they get older is the lower your muscle mass is, the greater your chances of all-cause mortality. Diabetes, insulin resistance, heart disease, all of those things go up when we have less muscle mass. We lose muscle mass at a much faster rate for every decade after the age of 35, 40 years old. Now, this generally falls off a cliff at the age of 60, but so many people think that it's beyond them even when they get to that age. But I've seen so many people start at an older age and live a much healthier and richer life where they're functionally still independent of anyone else. Now, if this is something that you're interested in, it's going to be super beneficial to get into it. Chronic pain is going to be reduced in terms of sensitivity if we're doing things right. Once you understand pain and what it is, the discomfort around it, you're going to be able to make choices that are going to help you to get where you want to be. Now, as I said, we work with ladies who are 40 plus. We work in small groups of 6 to 1 with a coach, which means that we'll show everyone the program. We'll tailor the program to that individual. We'll communicate in the background to make sure that you've got the help and support that you need, which is what a lot of people don't get when they go to commercial gyms. You walk in a commercial gym, you might have seen an exercise on YouTube, you try doing that, you've got pain with it, so you think, I'm not doing that, you go to the next thing. And what you end up doing is doing things that avoid that pain, but also potentially might not be getting you where you want to be in terms of goals. And this is what we try and help the ladies we work with to understand. We don't do it from a standpoint of you will always need us. We teach you what you need to know so you can make smarter choices for the rest of your life. Now, I want to talk about how to get started, not to get started with us, but just how to get started in general. Main thing is that you start slow. Figure out what's working, what's not working. Make a list of those things. It's not that we're going to avoid those things that cause pain right immediately. Like we're not going to avoid those things long term. Sorry. What we're going to do is we're going to focus on the things that are going to allow us to get moving, and then we can gradually build that in. Now, my recommendation for anyone who's getting into strength training is to do full body movements. This usually means doing a squat type movement, doing a hinge type movement like a deadlift, doing some form of pushing movement, horizontal and vertical, doing some form of pulling movement, horizontal and vertical. So when you're thinking of a pushing movement, you might think of a push-up when it's horizontal. You might think of a seated shoulder press when it is vertical. When we're thinking of a pull, that might be a lat pull down. When we're thinking horizontal pull, that might be a dumbbell row. When we're doing a squat, you can do your goblet squat. You can do a TRX squat if you need support because your joints don't allow for it. We can do a kettlebell deadlift. There is a multitude of ways that we can go down with this. My recommendation is, in terms of exercises, 3 to 5 exercises. Do that 1 to 3 times per week. You do not have to go into the gym every single day to get the best possible results. Every single time you go in, you'll learn a little bit more about your body, what works, what's not working. Make some notes on that. You don't have to record the weights when you're doing it, but it's something that we keep on top of with our clients. One of the things that I'm asked all the time is, how do we monitor, how do we track progress? Now, when it comes to pain and working out around pain, this is very, very individual, because session to session, we've got to ask, how did that feel? What did you experience? How are you feeling it? Where are you feeling it? What do you want to happen next? There's many factors that affect pain, and for some of the exercises, they're going to decrease the symptoms that you're experiencing. In particular, if we're able to mobilize some of the joints that are stiff as a result of chronic pain, you're probably going to notice some discomfort in terms of DOMS. Then once those DOMS have gone, you'll probably notice less sensitivity to that pain. So for example, if we get someone to squat like Hannah, when we were using her hips to do that, going up and down the stairs becomes easier. That was one of the first signs that Hannah noticed that her knees were getting better when she was training with us. The other side of that is it's important to listen to your body. I can't stress this enough. Once you're educated, once you're informed, it's really important that you check in with your body so that you're making the right decisions moving forward. I have been guilty of this in the past, where I have rehabilitated an injury and then I've started to load it up, and then I've consistently tried to load it week by week by week by week. And then over time, what I've noticed is that that pain has slowly crept back in, and then I'm getting frustrated with myself because now I have to go back over and start working on mobility again, start reducing that pain so that I can get back there. And you end up yo-yoing when you're doing that. So it's really important to listen to your body and just understand what you're actually doing there. Note the things that are working and make reflections on the things that are causing pain. As I said, sometimes you might go in, it causes no pain. Next time you go in, it's causing a little bit of pain. When that happens, it's time to either work with someone or to look at things on YouTube. That can be a good example of mobility exercises that are going to help, particularly around that area. We do a ton of stuff. So if you haven't already, join our Facebook community. It's absolutely free. We are putting in more and more tips and training advice in there so that we can help as many people as possible. If you can't see that on Facebook, drop us a message either on Instagram or on our Facebook page, and I will add you to that personally. So the last thing that I want to sort of wrap up on this is, like, you don't want to avoid the things that actually hurt. We want to understand what is hurting and what that pain sensitivity is like. So if I get someone to squat, I might say to them, how does that feel on a scale of 1 to 10? So that's a pain scale that we use that helps us to understand where that person's problem lies. Now, there is a lot of things that go into this as well, because I have spoke to people who've told me that their pain is an 8, but when I visually look at them, they don't seem like they're in pain. That's not me dismissing that person. It's me trying to understand where that person's coming from. So it's not just a case of asking the question, where is your pain at? It's a case of understanding what that person is going through, the things that are affecting that pain on that given day. Because, as I said, some people are going to get flare-ups with pain, with back pain. If you've experienced it before, chances are you've got a higher chance of experiencing it in the future. And we've got so many ladies who are in a much better position that understand the body better, that when things happen and they've got a little bit more pain, we can dial it back a bit, still get a good training session in, focus on mobility, and help them to overcome things. Now, the take home from this is that pain is complex. It is going to be turned up or turned down based on what we're actually doing. Strength training can benefit you in turning down that sensitivity to pain, but also there are elements of it that can turn it up. If you're going to train, if you're going to go down the avenue of strength training, take things at a pace that is comfortable for you, but make sure that you check in with yourself to reflect on what is working and what isn't working. Having the understanding around it gives you the power to make the decisions to change it. Strength training can be great for increasing your resilience to pain and avoiding future problems as well. So if you decide to get started with it, as I said, just take it slow, gradual steps, or seek some help. Listen, I hope that you've enjoyed this podcast. Hopefully you found it insightful. If you've got any questions around pain, I would love to know, because I think that this is such a complex topic and I would love to create some more podcasts around this. So if you've got any questions, please feel free to reach out to us on Instagram or on Facebook. We've started to put some videos out on YouTube as well. So if you want to watch the video of this, it's just my mug and a standard video. You can watch that there. But listen, if you found it helpful, please subscribe, Please share it to a friend. If you know that they're in chronic pain and it could potentially help them, it would be awesome. And if you've got any feedback, please send that over as well. Anyway, I look forward to seeing you in the next one.